When you or someone you love receives a cancer diagnosis, finding the best cancer treatment and care is a top priority. Here at Gibbs Cancer Center and Research Institute, you and your loved ones are guaranteed state-of-the-art personalized care. Today, we'd like to take you inside and get a first-hand look at all the wonderful and promising events that take place here at Gibbs Cancer Center.
So there are a lot of things that make Gibbs Cancer Center and Research Institute different from other cancer treatment centers. I think one of the main things is that it is a great balance of really top-notch clinical care with a very ongoing research program that's been going on now for over 30 years. A lot of other centers are really one or the other. They're either a research institute or they're just a clinical setting, but this really has a great balance of both.
A normal day of work here at Gibbs is a busy day, a lot of patients. There's good stories every day, and then there's some harder stories, but it all makes worth coming to work every day.
Good morning, Mr. Oots.
Good morning.
You're the next contestant. Come on down.
Come on down. Coming with you.
It's always difficult to give bad news to patients and their families. There, I think, is an empathy that you have to have in order for you not to seem callous in doing it. You really have to care about people. You have to care about the patients and their families and relate to what they're going through. Because even if you've done it 5 times that week, this is the only time they've heard anything like that.
We'll get your blood pressure.
Okay.
And if you would, just relax your arm.
All right.
Now I know I was the last patient of the day, because they bring you in there and they talk to you about what's happened. And it was a tough ride home for my wife and I that day, especially to give a phone call to my children and say, hey, I've got the C word.
When I found out my husband had cancer, prostate cancer, all the bad things went through my mind. It was hard for me to fathom that he wouldn't be there.
I know many people who've been diagnosed with cancer. The one that probably touched me the most was when my mother was diagnosed with cancer. She died 4 months after her diagnosis, and so that was really very difficult for me, but also showed me a lot about what's important in terms of taking care of patients and their families. The one positive thing, if there's anything that came out of that, I think, was the ability to relate to patients and family members in a way that I really never could have before that.
I knew a little bit because a friend of mine had prostate, but when you find out you've got it, it's a whole different animal. It affects you that in a daily sense that you didn't think it would.
I guess I'm the jokester of the place. So if I can make a joke, or I've got card tricks.
So you have to watch me close because I'm tricky. So this is my magic box I keep my cards in, okay? You watching me? You watching me really close?
Anything that I can do to distract you just for a few minutes.
You are good.
And patients tend to love it.
She brought humor to us. And I like to joke around and kid, and she just fit with me just perfectly, because, I mean, she is just a character in herself.
It makes me feel good, and the patients feel good too.
I said to Melanie one day, and a guy says, Kim is always laughing, and she never has she always has a funny bone in her body. She's always cheerful. And Melanie says, you know, Ron, isn't that remarkable? Because she's gone through cancer in a female way, and she gets very, very tough kind of cancer. And she says, and after I was told that, I admired her more.
Well, when I got the news myself that I had cancer, it was devastating. I couldn't think of anything else. I know the doctors kept talking, but I couldn't hear anything. I've been a nurse many years and did a lot of different things, but been in oncology since I myself was diagnosed with cancer. because I feel like I can understand how people feel or patients feel, and I can help them through that confusion because I've been there. It's one thing to tell patients I understand, and they're like, not unless you've been there, you don't understand. And I can say, well, I'm a cancer survivor too. I have been there. So the first thing we're going to do is get your weight. There's a scale here behind you.
Okay.
We'll get your weight, and then we'll get you in the room and talk to the doctor.
One of the things that I have learned over the years is that we have to, as physicians, take some measure of satisfaction out of helping patients in ways that may not actually get rid of their cancer.
And treating the families too is another big part. Just because you're the person with cancer in the chair, cancer affects the whole family. So if your brother's with you or your sister or your children, you've got to make them feel comfortable. So answering their questions and making them laugh and seeing that it's not a dark, scary place here. It's actually a beautiful facility. And people are laughing and having a good time.
The nurses and doctors made me so relaxed, waiting and all that, because you don't know what's happening in there. And they would take me in and they'd talk to me, or they'd show me something that was happening, and they'd say he's fine. They'd keep coming and relating. It was for a cancer area. I mean, I've been in hospitals many times for myself, and I was never as relaxed with the care there as I was in that office.
Gibbs Cancer Center has a great cast of people that support you here that is phenomenal. Through the whole process, from the day you meet them to the day that I walked out that door, they were a family to me. And I couldn't ask for a better team.
Don't go anywhere. We'll be right back with more from the Gibbs Cancer Center and Research Institute when today's physician returns. Welcome back to today's physician. Gibbs Cancer Center and Research Institute is a proven leader in providing effective cancer treatment through technology, professional expertise, and an exceptional level of personalized care. With 4 locations in the upstate, this nationally recognized research and treatment facility is committed to expanding world-class oncology services and research in the Carolinas.
Different cancers are very different from one another, both in terms of our expectation of how patients are going to fare with them and as far as what treatment options are appropriate for them.
The more I talked to Dr. Freed through the process, I felt comfortable in how he explained it to me, that I probably was a better candidate for the radiology than even the seed, based on some tests that they had run. And then behold, I had heard about the laser knife coming to town.
CyberKnife is a radiation treatment device that is actually attached to the end of a very precise robot.
It is essentially a radiation-producing machine called a linear accelerator that's mounted on a robotic arm. It's actually the same type of robotic arm that's at the BMW manufacturing plant.
When we mix the precision of that robot, the mobility of it, with advanced software and advanced imaging, we're able to really pinpoint where the radiation should go and ensure that radiation is being delivered exactly where we want it.
The laser knife scared me because I was afraid, since he was the first one. And I knew they had machines all over the country, but I'm saying, okay, they're just putting this in and something could go wrong. But he was adamant that that's what he wanted to do, and so I had to stand behind him.
But I was the first one to be put in, and a lot of people were going, oh, you're the first one. And I felt differently. I said, because they had the whole team who built that equipment was here from California. They had the technicians trained. If you're going to have any eyes on you, you're number one, they're going to have a lot of eyes on you. So I felt very, very comfortable in being the #1 patient here at Gibbs.
Not only do we have a CyberKnife, we have the most advanced CyberKnife in the world.
A lot of times CyberKnife is only 5 treatments. So you get higher doses of treatment. It's more precise treatment. So you're not going to be here, but just say 5 times.
If I'm treating a patient who has prostate cancer, I typically treat that for a 44 treatment course. That takes about 9 weeks of the patient's time and costs quite a bit of money. The CyberKnife treatment is a 5 treatment course that actually costs significantly less than a conventional course and works just as well as the long course of radiation with similar side effect profile, except that the side effects are usually resolved by the time you just be getting to the end of the normal treatment course.
No matter what tumor you have, you give it enough radiation and you'll kill it. But the thing that you don't want to do that because you have healthy tissue around. So the way that you spare the healthy tissue is you reduce the size of the field, you reduce the dose to the surrounding healthy tissue, and you do that with imaging and precision of your beam.
There's a thing called a nugget. A gold nugget. You think we're rich, but it's a small, little tiny thing that they have to insert into your prostate so that it can target, the laser beam can target dead on where the problem's at.
Part of the advanced imaging system that comes with the CyberKnife is the ability to track what's called fiducial markers. And what these markers are most of the time they're made out of gold. We implant those surgically inside, for instance, prostate. We'll put 3 of them, sometimes 4, inside the prostate. We then image the patient using CT, and we use the location of those gold fiducial markers to actually deliver the beam. We use them kind of as waypoints or as directional markers. Every 15 to 20 seconds during the delivery of the beam, we can keep track of where the prostate is using these fiducial markers.
What makes it appropriate to use the CyberKnife rather than a traditional, conventional linear accelerator is something that can be well targeted, something that is small, and something that benefits from a very high dose over a short number of treatments. The prime example of that would be lung cancer. So for early stage lung cancers, we could treat that with 30 or 35 radiation treatments conventionally, and that would give us somewhere around a 50 or 60% rate of local control or of getting rid of that spot of cancer. With the CyberKnife, we can treat that in 3 treatments and have greater than 90% local control rate. So it's shorter, it's more convenient for patients, and it works better.
I think one of the best ways that somebody with my technical expertise can help the patient is to give them confidence in the techniques that we're providing them and the actual equipment that we're using to treat their cancer. Leading cancer centers throughout the world, they don't necessarily have what we have. We have more than some of them. So the CyberKnife you see right now is not the CyberKnife you're going to see a year from now. We're continually improving through research and through collaboration with the makers of the CyberKnife, and we are going to be able to provide you with a more accurate, a faster, better system.
You know, we're right here with some of the best treatments in the world and some of the newest equipment, and you can get that right here in Greer, you know, right here in Spartanburg, in your backyard, so close to home.